Welcome back to the channel. Last class we have started with odontogenic tumors. We have dealt with some of the terms. Today we'll be starting epithelial tumors and we'll be starting ameloblastoma. Okay, let's start. Okay, epithelial odontogenic tumors, ameloblastoma. Okay, there is a mnemonic for the definition of ameloblastoma, that is UNIAC. U for unicentric, N for non-functional, I for intermittent in growth, A for anatomically benign, and C for clinically persistent. So, it is a neoplasm or tumor which is unicentric, non-functional, intermittent in growth, anatomically it is benign, and clinically it is persistent. This is the mnemonic for ameloblastoma. ओके, बिफोर डीलिंग अबाउट व्हाट इज़ अमीलोब्लास्टोमा, कहाँ उसका प्रेजेंस ज़्यादा है, कहाँ एब्सेंट, विल डील विद सम ऑफ द टर्म विच विल मेक आर टर्मिनोलॉजी क्लियर अबाउट अमीलोब्लास्टोमा. ओके, some terms and types. Okay, first there are mainly three types, that is ameloblastoma in situ, microinvasive ameloblastoma, and invasive ameloblastoma. Okay, what is ameloblastoma in situ? In ameloblastoma in situ, there are two kinds of ameloblastoma: mural ameloblastoma and intraluminal ameloblastoma. What is mural ameloblastoma? It is developing in and it is limited to the epithelial lining of the cyst. ओके, जिस cyst से ameloblastoma डेवलप हो रहा है उस cyst के या तो epithelial lining पे या epithelial lining के ऊपर ये डेवलप होगा. This is mural ameloblastoma which is developing in and it is limited to epithelial lining. This is called mural ameloblastoma. This is epithelial lining, this is connective tissue, and this is the bone. Okay, so mural ameloblastoma, that is in situ ameloblastoma, is limited to the epithelial lining. Now, second type of ameloblastoma in situ is intraluminal ameloblastoma in situ. In this, ameloblastoma arise from the epithelial lining of the cyst and proliferate into the lumen. Okay, it is in the epithelial lining, it is arising from the epithelial lining and proliferating into the lumen. So this is intraluminal ameloblastoma, but both are in situ ameloblastoma and both are treated by cystic enucleation. Okay, now coming to second type, that is microinvasive ameloblastoma. It also has two types, that is intramural microinvasive ameloblastoma and transmural microinvasive ameloblastoma. What is intramural ameloblastoma? It is arising from the epithelium lining and proliferating into the connective tissue layer of the cyst. It arises from the epithelial lining but it proliferates to the connective tissue up to a certain length, not whole length of connective tissue. Intramural microinvasive ameloblastoma proliferate into the connective tissue layer up to a certain length, but it arises from only epithelial lining. Okay, now transmural microinvasive ameloblastoma, it arises from epithelial lining and proliferate through the complete thickness of connective tissue layer of cyst. See, it has arisen from the epithelial lining but it has proliferated to the complete thickness of the connective tissue. This is transmural, this is intramural, both are microinvasive. Okay, so this microinvasive intramural can be treated by cystic enucleation, but microinvasive transmural has to be done with resection approaches. Okay, now coming to the third type is invasive ameloblastoma. Okay, what is invasive ameloblastoma? It also has two types, that is invasive ameloblastoma arising from the lining of cyst and invasive ameloblastoma which has no relation to the cyst. Okay, invasive ameloblastoma arising from the cyst, ameloblastoma arising from the epithelial lining of the cyst, proliferating through the complete thickness of the connective tissue layer of a cyst and into the adjacent bone. Okay, this kind of ameloblastoma, that is invasive ameloblastoma, will start from epithelial lining, will continue with the complete thickness of connective tissue and will invade into the bone. okay, will invade into the adjacent bone. Okay, this kind of invasive ameloblastoma can be treated only by resection approach. There is no conservative approach for this type of ameloblastoma. Okay, now only invasive ameloblastoma, it is solid or multicystic ameloblastoma unassociated with cysts. It is not associated with cysts. Okay, the treatment is same. Okay class, that's all for today. We have dealt with different types of ameloblastoma basic. Now we'll be starting with some of the clinical presentation, some of the terminology confusion in next class. Okay, till then like, share, subscribe and comment. Bye.